Dr. Iman Moghal, and I will be talking to you about versatility today. But before that, just a bit of an introduction from myself. So I'm here because of Dr. Misbah Koshi and Mr. Iqbal Koshi, who are my mother's chacha and chachi. So that's why I'm here today. So first of all, I have to apologize to you, or have a little bit of a cough. So if I do cough in the middle, I'm sorry. I'll be talking to you about versatility and how important this is within the field of medicine and also outside of medicine, generally in life, and how it helps you get through different things in life and different aspects of life. Okay. From here, I moved to London when I was in class 7, and this was a huge adjustment for me, not only culturally, but in terms of religion, in terms of the people, in terms of the location, in terms of losing, being around family members all the time. So I found this incredibly difficult, and at the age of 12 I realized actually it's very important to be versatile. And what is it to be versatile? To be versatile is to be able to adapt to different situations, to be able to manage yourself in different situations, and to be able to do different things at the same time. So often as medical students or as doctors, people think we have our heads buried in the books, and all we can do really is study, and we're bookworms. So I had a different idea of how I wanted to go about things, and a different idea of what I wanted to achieve while still doing medicine, while still becoming a doctor. So this is when I realized actually I need to adjust, I need to adapt, and it took me a long time to do that. My mum will tell you, who is here today, she will tell you I used to cry myself to sleep every night for a long time, for many years, because I missed being in Pakistan, I missed my family, I missed my home. So I started my secondary schooling over there in London. Didn't get on too well with one of the schools, moved to a different school, after which GCSEs is what we call O-levels over there, as you guys all know. I did my O-levels, I then did my A-levels over there. I really started studying around when I was in class 10, and I realized how important it is for a woman to be independent, most of all. This is something I realized quite early on in my life, and I think this is what really made me study harder and made me want to make something of myself. So when I started studying here, I used to study for long periods of times. So I would sit there studying for, you will not believe it, or maybe you will, because many of you study for long periods of times, but I would study for 12 to 14 hours a day at this point. And then I did my A-levels, and I applied to medical school. So medical school applications are a little bit different in the UK. You have to do some entrance exams. There's an exam called a BMAT, there's an exam called a UK CAT. And these are really tests that allow for the admissions committee to see that you are someone who can do more than just study. Because everyone will have the grades, everyone will have their A stars, everyone will have all of those things. So these tests are a bit complex. Being someone who had studied in Pakistan, grown up in Pakistan, I found them particularly difficult. Whereas over there, the students do go through similar tests when they're in about class 7. So I missed these. So again, it was something I found quite difficult, something I had to adapt to, and something I had to learn really by myself. And I probably had to work a little bit harder than other people. We have to do a personal statement, which is a statement of your skills, your attributes, why you want to study medicine, what skills you bring to the table. And it's very important to have some extracurricular activities. So many people will play the piano, play the violin, many people will do sports. I didn't do a lot of those because growing up Pakistani, I think us girls generally, we don't do a lot of that. I had a massive interest in fashion from the start. So I would always say to my mother, I want to be a fashion designer when I was growing up. And she has this statement that she always used to say, well, you can become a doctor and be a fashion designer, but you can't become a fashion designer and be a doctor. So I said, okay, I'll become a doctor, and then I'll leave medicine and I'll become a fashion designer. But that obviously never happened. And grades obviously is very important. Everyone has those. Everyone applying to medical school has those. So to put it into context, I applied to 4 medical schools. I applied to King's College London, I applied to St George's, which is the University of London, and then I applied to 2 outside of London because London is quite competitive. So I applied to Birmingham and I applied to Manchester. And I really didn't want to go there because I didn't want to leave home. So when I was applying, I didn't realise just how competitive it was. I think we had about 12 people to one application. So this is where I spent about 6 years of my life. I did 2 preclinical years and 3 clinical years of medicine. I actually took a break in between in medical school, and I'll talk to you a little bit more about that later on. So my MBBS was actually 6 years and not 5 years. So in 2011 I started at King's College London, and I was there until 2014. So I did 2 years of traditional lectures. It's a very dissection-based university, so we did a lot of anatomy, a lot of seminars, a lot of tutorials, no clinical work at all. And then we started clinical work, and I did 1 year of hospital medicine, which was very, very different to the traditional teaching. Then I was a bit tired of studying, I think as all of us get, and I took a year out. So I took a hiatus from medicine. This is quite common in the UK. So people will often do a BSc, a Bachelor's in Science, and you can do that within 1 year as opposed to within 3 or 4 years, because you've done your 2 years of medical training. So this is called a Bachelor's of Science in Medical Sciences with gastroenterology and with hepatology. And this I did from Imperial. So again, I moved to a different university. Again, I found it a bit difficult to adapt. You would think at this point I would find it easier to adapt, but I didn't. So again, I realized actually the importance of being a versatile person and the importance of being able to adapt. And this was a different college, the style of teaching was different, the people were different, and yeah, it was a different experience. It was a great experience. So I did this within a year, and then I went back to King's College London. I finished my 2 clinical years, and they make you do something called a situational judgment test over there to get into your house job. They can place you all over the country, so they can put you in Scotland if they wish, and obviously I didn't want to go to Scotland. This test is quite difficult in the sense that they give you scenarios that you would be presented with as a doctor, and they want to see how you would deal with the scenario. So an example would be, they would tell you, well, your consultant or your colleague has come into work and they smell of alcohol. That's a very common example they'll give you. How do you act? So you will all know when someone senior does something that you don't agree with, or is something that's quite wrong. It's very difficult to deal with that situation, and they want to see how you react to that, and many similar scenarios. So then you do this test so you can get your house job. So this is my journey really. I started in LGS, I went to King's, I went to Imperial, and then I now practice in primary care. I'm a consultant in primary care at the Royal College of General Practitioners. I'll talk to you a little bit more about this. In the middle, when I was in medical school, around my 4th year, I was tired. I got really, really, really tired of studying. As you can imagine, all of you have been studying since you were 14, 15, and I lost interest. But I knew I had to finish medical school, so I thought to myself, well, what can I do in the meantime to keep myself going, to stop myself from getting so burnt out? And that's when I started this page, The Pakistani Bride. So that was in 2016. And really the reason why I started it was for selfish reasons. It was for myself. It was just for me to have an outlet, for me to be able to do something other than medicine. And the way I would study is I'd study for 3.5 hours, and then I'd take a 15-minute or 20-minute break. So within that 15 or 20 minutes, instead of watching TV, instead of scrolling through something, I thought I would just post my interests on this page, and it was anonymous, just completely anonymous. And I started by looking at where there was a gap in the market. I thought, well, if I'm going to do something, it needs to be something important, something that's not already there. I don't want to repeat anything. So I looked and I looked on Instagram. There was nothing. I couldn't find anything for Pakistani inspiration in terms of, bridal glam and things. There was lots of Indian pages. There was lots of Caucasian pages. And I thought, I'll start this. I'll start something about the Pakistani bride, and I will just post things that I enjoy. And I did. And what I did that was slightly different, I think, to other people was I looked for brands that other people were not posting. So I didn't start by posting, these very, very fabulous designers that you know of, Elan, Faraz Manan, all these people. I looked at the smaller designers that maybe not so many people look at, not so many people can reach, because actually our population of Pakistan, the affordability of these designers, Elan, Faraz Manan, that's the 1%. What does the general population buy? What can we buy and what can we afford? That's a lot of other designers, a lot of other vendors. So I was looking at these, and I would go through their pages. I'd spend quite a bit of time running through their pages, looking at the one thing that I would like, and just do a post about it. Do a post about what I liked about them, where they were based, what their price range was, what services they were offering. And this is how I started. And initially it was just almost like a Pinterest page, and there wasn't much going on. But very quickly I saw it growing more and more and more, and I started the hashtag. The hashtag initially was Pakistani Bride. I think I've changed it to the Pakistani Bride. And clearly a lot of people were searching for that hashtag, so I was getting a lot of likes. And then there came a point where I was just gaining 1,000 followers a day. And I remember getting to 5,000 followers, and I thought, wow, I've made it. I'm a big Instagram blogger at this point. And alhamdulillah, since then it's grown, it's gotten better, and it's changed. I post a lot of things about myself. I do a lot of things myself, so you'll see the first 5 posts is me. I've been to a wedding recently. So I will do a lot of things like a photo shoot. I'm rewearing one of my bridals over here. And that's really for inspiration. It's for inspiration for other brides. And then I will also post about different things, different vendors. I still do that. And I'll talk to you a little bit more about what I do and what you can do with social media. So what can you do with a social media platform, and what do I do with a social media platform? So if you have more than 10,000 followers, you can have paid promotions. So paid promotions is people paying you to either wear their clothes, their shoes, offer their services such as photography, and you will work with them. It doesn't have to be yourself. You don't have to post your face. You don't have to do anything that you don't want to do. The other thing is advertisements and endorsements is something you can do. So a lot of brands will get you to advertise a whole collection with them. So that's another thing. Content creation. Sometimes you will just do things that you enjoy for fun, and there's no motive behind it. So if I go back, all of these in the yellow, that's just for fun. I didn't get paid for it. I spent a lot of time doing this. So I spent a lot of time getting ready, a lot of time shooting this, and I had a wedding in the evening. But it's something I enjoy. And if you enjoy doing something, for example, you might have a hobby like playing the piano, it doesn't seem like work. And it's a good way for stress relief. It's a really, really good way. The other thing you can do is collaboration. So you can work, like I said, with photographers, with makeup artists. In my case, obviously, if you wanted to do something different, you'd be working with different kind of vendors. And the most important thing is that this gives you a running stream of income. Now, for me, this is a side income. I don't spend my entire time doing this, but I often say if I did, I'd probably make more money than I make as a doctor. So something for me to consider. Or you can have this as a side income, which is great, isn't it? Who doesn't like extra cash coming in doing something that you enjoy? But yeah, as you know, a lot of bloggers now have millions of followers, and they do it as their main job, which is also great. So I think it's really important in this day and age for girls and boys to be versatile, to be doing different things. You don't have to open up a social media platform. That's not for everyone. But just to be doing something other than medicine, or something other than your current job, because times are changing. And we were talking about this. I was talking about this with Dr. Misbah Qureshi, how things have become a lot more versatile, a lot more different than they were many, many years ago. And it's important to keep up with the times. And actually, if you are studying some form of medicine, you are probably someone who can handle a lot of stress, and you can handle a lot going on at the same time. So if it's something you can do, absolutely, something you have an interest in, work on that. And I'll come back to myself finishing medical school. So after I did finish medical school, I did 2 years of foundation training, so that's a house job. That's 2 years in London. And during this time, in my second year, I thought, I'm getting a bit bored. So I've done the blog and I've done medicine, and what do I do now? So I thought, let's branch out into a different kind of medicine, and I looked at aesthetic medicine. And initially it can be quite daunting, because you'll often see people with huge lips, huge cheeks, huge jaws, and you think, oh, this is not something I want to create. But you'll also see people with subtle changes. You'll find people who have deformities from either trauma or from birth that they want you to correct. And actually that can be really, really rewarding as a doctor. And if you can do that in a non-surgical way, if you can do that without putting them under the knife, I thought this sounds fantastic. Definitely something I'm interested in. So I did foundation and advanced training in this back in 2019, and I started working on it quite swiftly. It is also aesthetic medicine, so it will also be people who want larger lips or they want larger cheeks. And for me, I thought, well, as long as it's within reason and no one is looking very, very different to what they initially looked like, that's okay. So this is something I started enjoying quite a bit, and I started doing this alongside my full-time job. So I was working 5 to 7 days a week, as you do in your house job. And then I started postgraduate training. So this was in general practice, which is primary care in the UK, and this was 3 years of training. So 2 years of that were spent in the hospital. 1 year was spent in what we call a surgery. So a surgery is basically a clinic. Primary care is very different in the UK to what I often hear about in other parts of the world. So in primary care, you will deal with 98% of the population and 98% of the problems, and you will not be referring these patients on. So if you've got patients with COPD, you've got someone with asthma, someone with heart failure, these are my patients, and they're going to come back to me, and I'm going to treat them, I'm going to see them. I'm not going to refer them to the cardiologist, I'm not going to refer them to the respiratory physician. You deal with them. So up until you've got 5th, 6th, 7th, 8th line management, you will treat them to the best of your ability. And if you can't, at that point, you will refer them to a cardiologist. I often hear in different parts of the world, patients are referred very early on to cardiology and endocrinology and all the other specialties, and it's different, of course, everywhere. But this is what primary care general practice is like. And there are a lot of different things you can do within general practice, and I do some of them, and I will talk to you a little bit more about some of them. So I got my consultant post last year in August, after 11 long years of training, which was nice. I took a 2-month break when I first got this post, and I just went on, I would like to call it traveling, but my mother and father will tell you holidays. I went on lots of holidays, and then I started work. So this is what I still do in terms of aesthetic medicine, and I've built on it since then. These are just some examples. So if you look at the top corner, it's a very subtle change, but it will make a huge difference to someone's self-esteem if they do feel their nose is a problem. Of course, not everyone will need this, not everyone will want this. But if you can do something to help someone, why not? So I generally add subtle, small micro droplets of filler right at the top, right at the bottom of the nose, and this is an advanced procedure, this is called the non-surgical rhinoplasty. This is not something you will do if you haven't been doing fillers for quite some time. Lips, people often want their lips enhanced, so you'll see 2 different kinds of lips there, and I've put a few more noses there, but I do Botox and fillers in all areas. So Botox you will do, yes, for wrinkles, but also for other things like hyperhidrosis, which is excessive sweating, so you'll put it in the axillary region, and that can be quite helpful. You can do masseter Botox for people who suffer from bruxism if they grind their teeth at night time, which can be quite helpful. In terms of dermal fillers are made of hyaluronic acid, so this is something that's naturally present within your body. You're just building upon that hyaluronic acid, so you're just replacing some lost volume. And if you look on the far right at the bottom over there, you will see a bit of a deviation in the nose on the right hand side. So this girl had a fall many years ago, and her nose had become deviated. So we added, this was quite a complex nose to do, even though it looks quite straightforward and simple, because there's a lot of scar tissue within the nose when someone has a fall or trauma or treatment. So we just corrected that, and if you look at the same picture on the other side, you've got a straight line going down the nose, and that's how you know that you've corrected it, if the light shines straight down the nose. And she was really pleased with her results. So this is something I really, really enjoy in addition to general practice. It just gives me an extra bit of satisfaction. So what do I do now? I thought I would build upon my aesthetic medicine, so I did a fellowship this year. It was a 6-month fellowship in aesthetic medicine, so it's called an Aesthetic Intelligence Fellowship, where we spent many days over 6 months practicing, doing tutorials on different things that we hadn't done before. So the nose I only started doing this year. Really, really enjoy it. I also started doing under eyes, so a lot of people will have hollow under eyes. It's called periorbital filler. And what you're doing there is you're just replacing the body's natural fat loss, because as we age, we lose fat in our face. You're just replacing that with hyaluronic acid. So these results will last you anywhere between 12 and 18 months, and then they will go. And the best thing about this is, if you don't like it, you can just dissolve it. You can get rid of it. There are other fillers that are non-dissolvable. I don't do those, so I'm not going to talk to you very much about those. I do 6 sessions of general practice. So general practice is primary care medicine. 6 sessions means 3-4 days. So a session is about 3 hours. That's about 16 patients. And our appointments are about 10 minutes long. Within those 10 minutes, you see the patient, you examine them, you diagnose them, you manage them, you refer them, which can be quite a tough job, which is why I do 3 days, because any more than that, I feel like for me it is a bit too much and I need something different to do. And a lot of doctors in the UK will do 3 to 4 days of general practice. Not my father, who's also a doctor. He does 5, sometimes 5.5 days. But I think he's just so resilient, and people who are one generation above from us, you guys are just more resilient than we are. It is just how it is. So the other thing I do, just to mix it up a bit, sometimes I feel like I do too many things, but just to mix it up a bit, I do some joint injections and also some minor operations. So joint injections is injecting steroid into the joints, and this will be for things like arthritis. This can provide great amounts of relief to people who perhaps don't want to have a surgery, who don't need to have a surgery, young people who've got knee arthritis, so it can be quite helpful. And this is a blind injection, so you just feel the landmarks and you inject. People also do injections for the Achilles tendon, so if you've got plantar fasciitis, for example. I don't do those, but that's again something that you could do. And then the other thing is minor operations. So these consist of lumps and bumps, sebaceous cysts, incision and drainage, things that you can just do with a bit of anaesthetic, sutures. So I decided to teach medical students at some point. I can't remember quite exactly, because I really enjoyed my time at medical school for the majority of it, and I thought there has to be some way to give back. So I started by becoming a medical examiner for final year students at Barts in the London. You might know this as Queen Mary University London. Their medical school is called Barts in the London. And that was quite an interesting thing to do, and actually gives you a chance to reflect on what you might have been like when you were a medical student. So this is something that I started doing not too long ago. I'm also working within the Faculty of Medicine at King's College London and also Barts in the London School of Medicine. And I mainly teach their second years, third years and final year students, and I teach them about general practice, primary care, and I also teach them about communication skills. So there's a huge focus on lots of skills, especially at my university, communication skills being key, because I think a lot of the doctors many years ago, you know, everyone knows their stuff, everyone knows what they're doing. If you're a doctor, you've studied hard enough to get where you are, but sometimes it's hard to communicate that with the patient for various reasons. One of the big reasons over there is a language barrier. A lot of students, international students who have come from India, from Pakistan, from Bangladesh, they sometimes find it difficult to communicate with the Caucasian patients, because actually, even though everyone is speaking perfect English, the way they're understanding it is different, the dialect is different. So there's a huge focus on communication even throughout postgraduate training. So a huge focus on interpersonal skills. And actually, just going back to communication skills, I found it really difficult to communicate with people when I first moved to London. I had no trouble speaking English, but I found that actually the way they were talking was completely different to the way I was talking. I wasn't understanding what they were saying, because you know there's various phrases and things. So very, very important to have good communication, very important to have good interpersonal skills, good teamwork skills, good leadership skills to be a good practitioner. I also teach at the Royal College of GPs, so that's the Royal College of General Practitioners, and I've told you a lot about aesthetic medicine already. So aesthetic medicine I will typically do 1 to 2 days a week, and that's enough for me. You will get doctors who will do it for much, much longer. And my most fun thing that I do is managing the Pakistani bride. So this takes a lot of time. My husband will tell you, because he'll find me on my phone all day long. You have to do daily posts, you have to do daily stories, you have to keep creating content that is new. I do Q&As sometimes. A lot of them are medical, because actually a lot of the people following me are medical students, which is nice, mixes it up. And lifestyle advice and paid promotions like we talked about before. And currently I'm doing coil procedure training. So the coil procedure is a part of family planning medicine. And where I work, a lot of the population is Southeast Asian, so there are Bangladeshi, Pakistani, Indian women, and contraception is actually not very well covered in that area, and they don't know a lot about it. So I was finding it was difficult to send them to other places to get the coil. So I thought if I offer it within my practice, actually I will be able to talk to them, consent them and do it for them at the same time, because sometimes they will have 5, 6, 7, 8 children and they will not have the resources to support these children. They will not have the family support that we might have here. So that's what I'm doing at the moment. I haven't finished it, but that's something in the future I'm looking to build upon. So how do you have it all? How do you achieve everything that you want to do? Time management is something that's really, really key, and I think time management is a very difficult skill to master, because typically you will want to do what you enjoy a lot more than what you need to do. So for me, I think setting myself targets is very, very important. I used to set myself targets to the minute, so at 7:56 p.m. I will have finished this topic. And my eating break, as my mother will tell you, would be for 10, 15 or 14 minutes depending on what time I had finished. So if I didn't finish my work by 7:56, I'm sorry, I didn't have my dinner. I can't have my dinner. I have to keep studying. She would sometimes come and start feeding me morsels in my mouth, which was nice. Dedication and losing out on some of the fun is okay. I spent a lot of my younger years glued to the books while all of my siblings would go out. They would go out. There's a lot of this culture of going to the cinema or going out every single day in London. So everyone would be going to watch a movie, going for dinner, going out on the weekend, and I would just be glued to the chair. So a lot of my life lessons are from my mother and my father, and what both of them will tell you is that it's better to actually lose out on some of the fun now and just enjoy yourself for the rest of your life, rather than having to work hard for your entire life. So this is what I did, and this is what I still stand by it. I'm still glad that I did that, and I didn't have too much fun when I was younger. Be creative. Use that side of your brain. You're already using the science side of your brain because you're all studying to be practitioners. But creativity actually stimulates a part of the brain which is slightly different. So be creative whatever way you can. One of my friends from medical school, she was great at doing mehndi. So she does mehndi professionally now and she loves it. She's also a full-time doctor, and that's okay. That's something you can do if it's something you enjoy. And follow your interest. I think that's the main thing with medicine as well, following your interest. I tried to follow my interest when I did my intercalated BSc at Imperial. I thought I wanted to be a gastroenterologist for quite a period of time. Doing that made me realize I don't want to be a gastroenterologist. So often you'll also figure out what you want by following your interests. And a huge thank you to my parents for allowing me to be here to talk to all of you today. Thank you very much.